Good morning, everyone. Welcome to the Planning for Health in the time of COVID-19 or coronavirus 19. My name is Miguel Vazquez. I work for the Riverside County Department of Public Health as Healthy Communities Planner. I am also the Planners for Health California point of contact. For those of you who may not know, Planners for Health California is an initiative that APA California established in 2018 under the leadership of the California Planning Roundtable. It was made possible through a grant from the American Planning Association with funds from the Center for Disease Control and Prevention. The main purpose of this effort is to provide a space for planners to collaborate with public health professionals, as the built environment is a crucial determinant of health. Since its inception, our 8 sections have independently established their own Planners for Health programs. This webinar was conceived about 2 weeks ago under the leadership of Diana Benitez, who is the APA California Northern Section Planners for Health lead, and also from the section's director. This free webinar is made possible by APA California, which has provided us with the ability to use this Zoom platform and other tools and direction to make it happen. Next slide. And you probably saw this disclaimer as you registered, so hopefully you read it. We'll make these slides available so you can reread it hopefully afterwards. Next slide. Actually, yeah, I already discussed this, so next slide. I'd like to take this opportunity to introduce our APA California President, Julia Lave Johnston, who would like to share some welcoming remarks. Julia?
Thank you, Miguel. Hello, everybody. Thank you so much for joining us. And I want to thank APA California Northern Section of Planners for Health for organizing this webinar. I'm very impressed by their quick action and leadership in this area. So thank you very much. So during this time, I want you all to think of yourself as leaders. I think planners are excellent problem solvers, but more importantly, we provide a crucial link between the communities we serve and our governments. And I think that by continuing to do our jobs well and being engaged and being reassuring and planning well, that we can have a huge positive impact during this time. And of course, APA California wants to support you all during this time. And I want to talk about 3 ways that we're thinking about doing this. And I want you to think if there's something else you think we should be doing or how we can better support you. The first way is by helping our members share information. So providing webinars like this. We do have a LinkedIn page that I'm urging people to go onto and share information. You know, not only best practices, but what are your challenges? What are the areas that you need help with, or you think that APA California should be doing something? And that's the second way that I'm hoping that we can support you, is by trying to provide support and meet those needs that you've identified. So I don't know, when we advertised this webinar, we also sent out a link to a letter that I sent to the governor on behalf of APA California, asking him to relax some of the timelines that we have for planning. And I emphasize that it's not because we aren't up to the challenge, but that we need some time to adjust, like everybody else does, in order to get our feet on the ground and keep doing our jobs well. So, you know, personally, I'm home with my kids and I have to take a break every once in a while to learn the latest TikTok dance. So I understand we all have new demands on our time these days. And third, and most importantly, I think that right now, what we can do as APA California is to provide a space for our members to connect. I know this is a really challenging time, and it's not just professionally, but personally. I think it's very stressful. And I really hope that we can continue to support you and provide that space for you to connect with other other planners. The world is much lighter if there are multiple shoulders holding it up. So I really hope that we can provide that space and support for you during this time. APA California, we really are your organization. Without you, we're really insignificant. So I'm hoping that you will all help us step up and do a great job supporting you. So thank you again for joining us. I really hope that we can pull together this time and be leaders in our community. So please do let me know what we can do to better help you take on that role. So I'm going to turn you back over to Miguel.
Thank you so much, Julia. Now, today we're coming together as planners to take action on an event that dramatically has changed and has affected our way of living. I am sure that plenty of you have seen maps like this one, which illustrates the challenge at hand, which is overcoming all negative impacts as a result of the coronavirus spread. As we were getting ready to put together this webinar, I was contacted by a good friend of mine who has a very good grasp on what's happening today. He sent me an email, and I'd like to read a few of the passages that he described. I think this would be a good way to prime the conversation, especially because of his role in this type of work. So he says, communities need to assess where they are at this moment. New cases, few cases, many cases, overwhelming number of cases. What is appropriate to do today or tomorrow will depend on which of those circumstances a community or state are currently in. If a community is still early, standard public health response may still work. If later, it may be too late for contact tracing and isolation to work. For both planners and public health folks, the stages of preparedness and response that communities need to plan for and implement as contextually appropriate are the following.
Those what
And
you
he
tell you
talks
if you need
about
CM credits.
There's
a plan for health call right now.
Can you guys mute yourselves?
Do it.
While we present? Okay, great. Here we go. So these are the ways that he suggests that we need to think, the terms in which we need to think of. So prevention focuses on preventing human hazards. These may be appropriate for places with few or no cases. Preparedness is a continuous cycle of planning, organizing, evaluating, and taking corrective action. This should be evolving and ongoing as each state or community react to where they are currently and where the trends say they are headed. Response is comprised of the coordination and management of resources, including personnel, equipment, and supplies. The response phase is a reaction to the occurrence of a catastrophic disaster or emergency. Mitigation is the effort to reduce loss of life and property by lessening the impact of disasters and emergencies. This could involve canceling non-urgent health procedures and setting up additional healthcare capacity for all the patients who don't have the coronavirus but still need care, which would free up critical care facilities for the coronavirus cases. And lastly, recovery consists of those activities that continue beyond the emergency period to restore critical community functions and begin to manage stabilization efforts. The recovery phase begins immediately after the threat to human life has subsided. The goal of the recovery phase is to bring the affected area back to some degree of normalcy. Next slide, please. Okay, so today we have an agenda to go through, And we have gone over a couple of things, but basically we're here to cover a couple of phases. The first one, we're going to have two presentations by two experts who have volunteered to share their knowledge and experience on some aspects of this subject. They are Beth Altshuler, who is one of the very few planners in the state and the nation that I would say that has a dual degree in public health and city planning. And also we will hear from Josh Abrams, who is a principal planner at Baird and Driskell Community Planning. And he will share an example from his work in San Mateo County. The second part of this meeting is an open forum. We have designed it in such a way that we could have breakout groups virtually, so we'll see how that plays out. And to lead us into those housekeeping aspects of the webinar, I'd like to introduce Diana Benitez, who, as I mentioned, is the lead organizer of this program. So Diana.
Hi everyone, my name is Diana Benitez. Excuse me, you don't see me in the camera. There are a few of you that signed up when we were going to have this event last week, and they're struggling to get on, and so I am in the back end making sure that everyone gets updated confirmation emails. But
Diana, do you want me to do the housekeeping so you can keep doing that?
No, it's cool. I just finished.
You got it.
I just finished.
You're a superwoman. So, thank you.
So generally, just to give you a bit of context, we had about 400 people sign up, and right now we have about 230 that are on the call right now. And so our initial idea was to have these breakout groups, and what's come to pass, because we're all learning about Zoom, is some of you are going to be to your in your assigned breakout groups, so not everyone, but we're going to have moderators in each of those groups. And so when you get to that breakout group, you're going to all decide as a group whether you want to talk about the assigned topic that the moderator had, or if you want to talk about things more broadly, or if you want to switch tactics, but we have discussion questions for all of you to look through. And another thing is, if you selected an other topic, we decided to just stick to the first main four, and we updated them a bit. So community and social services is also looking at health, and we're having housing also look at development. But if you selected an other group, please type into the chat right now what group you'd like to enter, and we can try to assign that, but just keep in mind that not everyone is going to be in their initial assigned group. Also, as you can probably tell, all of our participants right now are muted, but when we get to the breakout room discussion, you'll be able to unmute yourself. And if you have any questions, you can type them into the chat. We have our awesome tech person, Ben, who works for APA California, helping us out. And we also have CM credits for this session. And so you'll be getting these slides at the end. So you have the CM number right here, but also on the first page of the presentations. And we also wanted to see if we could do a quick attendance poll. Ben, if you can help me out. We have a few questions that we wanted to ask you all, focused on you're going to see my test of this on what you do. What do you do? And so the first question is looking at whether you're a student, you're a researcher, an academic, you work in a nonprofit, in grassroots organizations, private sector, city county planning. And so we're starting to get a few things in. It looks like so far we have a lot of city and county planning folks. We're also asking you about the scale of your work, whether you're mainly working locally, regionally across the state, or nationally. And we're also asking you what region you work in. And a lot of this, because this was APA California conversation, we're focused on the California sections, but we also have an outside of California option because we know that a few of you from Texas and from other states have signed up. And so let me see. So far for what do you do, majority of folks are city county planning and private sector consulting. For scale of work, a lot of folks do a lot more local work. We have 68% of respondents. And then regionally, we have mainly folks in Northern California. So thank you so much for taking part. We are now going to move on to the next section where Beth is going to talk about public health.
Hi, everyone. Can you all hear me okay? Yeah?
Yes.
Shake your head. Okay, cool. Yeah. So Miguel and Diana invited me to help organize this webinar, and I'm so honored, but I want to give a huge disclaimer that even though I do have a master's in public health epidemiology, I am not an infectious disease expert. I've never taken an infectious disease class, so I obviously cannot give anyone good advice on the specific, science behind the disease. My work fits more into the field of social epidemiology, where I work to assess and improve the social determinants of health. But I'll just be going over more basic public health concepts and knowledge and help guide us into the discussion. So, public health, hopefully many young children are becoming interested in public health as a career during this strange time. And public health really focuses on groups of people rather than just an individual. And at the core of public health does lie the principle of social justice, providing people the right to be healthy, and creating conditions that support their health. So in these definitions, you really see where planning does play a role in supporting public health. We're helping create those conditions for healthy public life. Next slide. This, in public health school, you kind of learn about the 10 essential public health services. You can see them listed here, and they fall under 3 categories of assessment, policy development, and assurance. And this pandemic is requiring the public health sector to kind of fire up all 10 services at once in overdrive. And a lot of what we hear in the news right now does fall under that assessment section, since epidemiologists are trying to figure out what the virus is, how it works, who has it, predicts who will get it, and so on. And while all the other community public health folks and policy folks are working on the other 8. Next slide. So epidemiology is another word people are hearing a lot in the news, so I thought I'd define it here. It's the method used to find the causes of health outcomes and diseases in populations. So in epidemiology, unlike in clinical medicine, the patient is the community and individuals are viewed collectively. That's why whatever our N is in data sets or experiments is always really important to have a large number of people, because we don't think the data is valid if it's a small N. So epidemiology is the study, scientific, systematic, and data-driven of the distribution, which is the frequency and pattern, and the determinants, the causes and risk factors of health-related states and events. So not just diseases, and these are all happening in specified populations. So you have to define where you're studying. Is it in a certain neighborhood, a school, a city, state, country, in this case, global. And epidemiology is also used to study the control of health problems. Next slide. So the other terms that I know we're all hearing a lot are outbreak, epidemic, and pandemic. So outbreaks are kind of the smallest scale of where this happens. Think of maybe a food poisoning outbreak that happens in one restaurant that might affect 100 people or something. So it's defined to a small area over a small, short period of time. Epidemic is one step up from there, where a rapid spread of a disease will happen in a large group above what's normally expected. And then a pandemic is when an epidemic spreads to multiple countries or the whole world, which is why this is now called a pandemic. Next slide. So there's a ton of information out there. I know we're all seeing lots of interesting articles in our social media feeds, on Twitter, and it's hard to know where to find the most trusted and up-to-date information. So Miguel wanted me to make sure everyone understood the hierarchy of public health in the US. So the Centers for Disease Control and Prevention is kind of the boss of all the local public health action. So unlike planning, which is very localized and locally controlled, public health departments in state and local areas do kind of take orders, I would say, in a situation like this from the CDC. So CDC is updating their website daily. They have really great guidance, especially around employee safety and things like that. So I encourage folks to look at it. State health departments are also allowed to put out orders, and if their orders are stronger than whatever the federal government is recommending, then it supersedes the CDC. Similarly with local health departments, so in the US, most counties or groups of counties have a health department, public health department, and even some cities in California have their own health department. They're working in close coordination with the hospital systems. So in New York, I know people are really starting to hear about how New York City hospitals are going above capacity, and so the state health department is helping to coordinate how they're going to be transferring patients to other hospitals upstate to spread out the burden, so individual sites don't get overwhelmed. So there are also two other organizations that I think are really great resources for planners or anyone just interested in diving in a little more. The World Health Organization, of course, but also the American Public Health Association. We can think of them as the APEA of public health. They are working in lockstep right now with the Institute of Medicine. They've created their own webinar series, bringing in kind of the top infectious disease experts. And I encourage you to look up, they have a series called COVID Conversations if you want to nerd out on the science of COVID. Those conversations have been quite interesting. And also they're a apolitical, nonpartisan organization. So I'll just leave it at that. Next slide. So this is the most sciencey I'm going to get on here. So Miguel wanted me to make sure to explain what is COVID and why is it dangerous. So severe acute respiratory syndrome coronavirus 2 is the official name, or SARS-CoV-2 for short. And this can trigger the potentially deadly respiratory disease that we are all referring to as COVID-19. One of the reasons this is such a dangerous virus is because it has a really long incubation period of 1 to 14 days. So people can be contagious even if they don't have symptoms. And if you think about how many people you interact with over a 1 or 2 week period, it's huge. And they're also finding now might be contagious for up to 8 days after your symptoms are already gone. So there's also a really long recovery time, which is increasing the burden on hospitals. The main mode of transmission is respiratory secretions. So of course, if you sneeze on someone or cough on someone, but also they're finding, and they've known for a long time, that this coronavirus, the respiratory droplets in the air land on surfaces and they can stay there for many, many days at a time. And I can't find a official authoritative source that says how many days they can live on plastic or on metal or things like that. Everywhere says different things right now, so I'm not putting it there. So just assume any surface you're touching in public has the virus on it, and use your elbow, use gloves. The other thing that is very dangerous about this disease is that it has an exponential growth curve, and each person can is infecting about 2 to 3 others. So it's spreading rapidly. So stay home. That's what we're all doing right now. It's a historic action that we've never experienced in this country for 100 years. Go to the next slide. Diana, okay. So you can see this virus has spread very rapidly. In the graph were that outlier teal line shooting way up. And, you know, this is partially because of our failure to get rapid testing happening out there, like Miguel was reading about in his email. So there's lots of parts of the country right now that think they don't have a problem, and people are still out and about in public life, and this number is spiking. Next slide. But we are seeing kind of promising results in the Bay Area. So the curve is flattening, people are social distancing, and deaths in the Bay Area are slowly starting to go down. Our shelter in place has just been extended through May 3rd and likely will go beyond that because people who were infected long ago are only going to start showing symptoms soon. Next slide. So the social determinants of health is the framework that a lot of public health folks work under. In the old, historically, public health departments have worked on the right side, the downstream, looking at risk behaviors, disease, injury, mortality. Now folks are working on social inequities, institutional inequities, and living conditions, which really overlap with kind of planning topics. Next slide. When we talk about social determinants of health, they're kind of the conditions in which people are born, grow, live, work, and age. And they're shaped by the distribution of money, power, resources at the global, national, and local levels. And there are what are responsible for health inequities. So the unfair and avoidable differences in health status that we see between places and groups. And these social determinants are very relevant in coronavirus because you can see how all of them are having disproportionate impacts on how people are experiencing the shelter in place and the actual virus itself. Public health emergencies widen social and racial inequities. I've listed a few here, but we're seeing xenophobia. You know, we know some groups have higher rates of chronic diseases. Low-wage workers are either out of work and, you know, can't pay their bills, or they're considered essential but don't have good protection and aren't getting paid well. We're, you know, our elections and census is not going as planned. Students are going to have different levels of e-learning success, and lower income folks who are more reliant on public resources, they're now closed. So public transportation is very limited. Parks, libraries are closed. So it has a very differential impact across our population. So what does this mean for planning? Next slide. We need to think about how we reimagine public spaces, public transportation in the future, or is everything going to go back to normal? We'll see. Will community engagement ever be the same? Will there be a national backlash against density? I would argue no. The first outbreaks actually did occur in suburbs. What tools do planners have to help the economy recover? How can we ensure people stay housed? And how do we want to be remembered in historic accounts about this pandemic? And I just want to end, like climate change, this is a challenging situation, but if we intervene, it definitely can be managed. But without extreme intervention, things can get very ugly. Next slide, there's some resources. And then the Riverside County Health Department just prepared this reminder. We want everyone to exercise, you know, stay social, at a distance, eat healthy, sleep, practice mindfulness, spend time outside, and go to the next slide. And after that little whirlwind, I just want everyone to take a second to close your eyes. And we're just gonna do a quick little stretching and breathing. So if you close your eyes, inhale, straighten your arms up. Let's see if people are in the video. Exhale, bring your arms down. Inhale, arms up. Grab your left wrist with your right hand. Inhale, stretch up, and exhale to the left. Take a deep breath. Inhale up, grab your other wrist, exhale to the right. Inhale, arms up, and exhale down. And I know we're short on time, so I'll just do one more. Just do a twist to your left. And exhale, twist to the right, looking over your shoulder. And exhale, come forward. You can open your eyes. And Josh Abrams of Baird and Driskell Planning Baird and Driskell Community Planning is going to share San Mateo County's case study. And I'll mute myself now.
Yeah, hi everybody. So I'm Josh Abrams. I manage 21 Elements. Feel free to get in touch if you want to follow up with anything, or if you want any of the resources I share, you can get them from the 21 Elements website. We try really hard to make sure we don't password protect it, and we try and make, as much as we can, make editable versions available so people can copy and use things as they see fit. Next slide. So 21 Elements is a county-wide collaborative in San Mateo County. We help cities with housing policy. We don't advocate, but if cities are interested in doing housing policy, we try and make it easier by doing things like writing staff reports or doing the background research. Anytime there's a shared interest between multiple cities, we're funded by the local governments and the Congestion Management Agency and the county. Sorry, next slide. Yeah, okay, good. I would just say most of the pictures, I don't have too many words. Most of them will just be my children. They'll probably appear at some point in the background, so I thought I would just highlight them when they're looking extra cute. So 21 Elements for most of this month has been working to help cities prepare for their housing elements. This is a major state deadline. It's a great example of what 21 Elements does. We're all on the same deadline. It's going to be really hard to get the housing elements certified this time. So we've been working with cities to raise awareness and get them prepared. Next slide. And then March 16th hit. We were caught off guard for a day. We weren't fully, of course, no one realized the shelter-in-place ordinance. So on March 16th, the health officers for the Bay Area released the shelter-in-place ordinance. And go ahead to the next slide. And then so basically the next day, cities started emailing each other. We have a listserv for the community development directors and a listserv for housing, for people working on housing in the county. And they started saying, what are you doing? What are you working on? And then we realized like that's one of the things 21 Elements does really well. We help people understand what's going on in other parts of the county and respond. So we started compiling all the plans. Can you do the next slide? You can't see all of them, but just so cities knew what was open, what was closed. So you could see if it was a 3, that meant the permit counter was totally closed. Other cities had it open by appointment. Next slide. And then we put together a bunch of calls and started to answer a bunch of questions. So people really they just wanted to connect and not be so isolated. So we did 2 calls in that first week. Now we're doing weekly calls. And it was good for us because as people were talking to each other, we were learning what resources we could do to help. So a lot of what we've done is gathering resources to share. So if one city wrote a continuing operations plan, we would grab that, they would share it, and we would put it on the 21 Elements website. Another city shared just the signage that they posted to close public facilities so other people could use that. We signed up for a bunch of Zoom accounts, so cities weren't able to sign up quickly enough, they could use one of our accounts just for free to test it out until they could get their own account. We came up with a bunch of questions for the health officer. One of the nice things when you're speaking for 21 cities, 21 jurisdictions, you're more likely to get questions answered. So there were a bunch of details like, do hotels count as lodging? Do you have to allow them? Or what if the health officer says something's okay, but a city doesn't feel they have resources to support it? Do they have to allow it? And so the health officer said, no, like Beth was saying, this is the minimum that has to be closed. But if you want to close more, have more strict restrictions, you're always welcome to do that. Next slide. So the next thing that came really clear was the inspectors, the building inspectors were on the front lines and were really looking for resources. They're going to people's houses or to construction sites, the one that were still open, and potentially were being exposed in unsafe situations. And they had a bunch of questions about what to do. So we gathered and are putting together protocols for inspectors, what you can ask when entering a house. Why don't you go to the next slide? I think I have. Yeah, so just something you could ask while making an appointment, and then also when you get there to reduce risk a little bit. And then it's the other questions. I should thank our public health friends, Dr. Jen Horney, Dr. Caitlin Jedalina, who volunteered their time to help us put this together. We also organized a question and answer session with those two epidemiologists, and all the health inspectors could just ask whatever they wanted to try and figure out how to be safe. Next slide. Oh, sorry, no, actually, I have a few more things about inspections. One of the questions that came up was if the health privacy rules apply. Like, can you even ask, have you been sick? So I've been really impressed with how willing different organizations are to help. So Change Lab Solutions, the nonprofit, and they've been shifting some resources to help with the COVID response, and they researched that question, and you can ask these questions. You can ask questions. There are full answers on our website, but it's okay to ask that type of questions. The other thing we're working on is virtual inspection resources. A lot of cities are, as quickly as they can, trying to move towards virtual inspection. So we're trying to help them understand what are the options with that. Okay, next slide. Another really important topic is just eviction moratorium or assistance for homeowners. So the county was working on a moratorium, so cities knew knew not to, because we were all talking, they knew they didn't need to work on it until they could see exactly what was adopted by the Board of Supervisors. And then we could talk about what potential additions cities wanted to make with mobile home parks might not be covered in the county one, or other little details like that. The other thing that is that we haven't done yet, but is really important to remember, is just if you can have money for rental assistance. Berkeley is putting aside some money to help people that are affected. That's a really important policy too. Next slide. The next thing that came up was deadlines. The APA is working on that. There's so many pieces you don't think about when a major event like this happens. So there's all these deadlines that cities have. They have to turn in their housing element annual reports by April 1st. Could they get an extension? No, but you can update it later if you need to. Also, things like the Housing Accountability Act and the Permit Streamlining Act have tight deadlines. If cities don't act, the applications are deemed approved even if they're not consistent with the zoning code. So I don't think cities have the option of waiving those deadlines on their own, but we're going to help get cities to support the APA's letter to the governor to get some temporary relief on that. So the next slide. And what we're beginning to focus on, we're slowly moving to kind of the phase two. The first immediate response was like, how do cities stay open? How do you get essential business done? And now it's like, what do you do in the new normal now that the calls are being forwarded appropriately and everyone has a laptop to work on for the city? One of the big things is going to be nonprofit and small business help. So I think some cities are looking at grants to help cities get by. Also, there's even just publicity. Cities can play an important role in just helping know which businesses are open and which aren't. So I think we'll be changing our focus as we get through the initial phase to other things like that are a little less pressing. Next slide. I just want to share a few lessons. It's really important to plant the seeds in good time, like have good relationships, have good collaboration with your neighbors, because in times like this, it's super useful. We actually are just starting another collaboration in a neighboring county, and it's really interesting the difference between the San Mateo one, where it's been going on for 12 years and there's a lot of trust and people are really chatty and happy to share Word versions of things rather than PDFs, and the ones that are just starting where people are more apprehensive, they don't know their colleagues as well, and there's just a little more like reticence. So if you can get that going in good times, that's super valuable. Collaboration is important. And the human connection is important. There's a ton of things that people don't have time to reinvent right now. So if you can share that, that's really important. And even just the collaboration on a human level is really important. There's this feeling of isolation among jurisdictions, and just hearing that other people were struggling with the same thing at the same time and seeing faces. I really encourage people to turn on your video. If you can, just seeing other people's faces, it really helps. It really helps psychologically. It really helps center people. Building trust is really important. I was referencing this earlier, but San Mateo County came in a really good position because we've been working on housing issues together for more than a decade. As much as you can, trust your neighbors and build that trust, and so you feel comfortable sharing things. And the last point is just remember the most vulnerable. I think Beth did a really good job of explaining it, but there's going to be huge differential impacts, and we should at this time focus most on the ones who are most vulnerable and who need the most help. Okay, but those are all my slides.
Thank you, Josh. So we're going to quickly go over what we're going to do in small groups, and fingers crossed that this works. I think it will. So Diana and Ben have been working tirelessly the last couple of days to get everyone into groups, and people have put their preferred group in the chat if you didn't register earlier. So once again, you're either going to end up in a group that talks about housing and development, economic development, health, community, and social services, and we'll talk about homelessness here. Of course, if the housing group also wants to share things about homelessness, please do. It's a huge problem and we need all of us thinking about it. And then the final group is transportation and public spaces. So next slide. So community agreements, just be respectful. If you're talking a lot, let other people get a word in, raise your hand. There's a button where you can raise your hand to request the floor. If you can't find the button, just go in the chat that you have something to say. Mute if you're not speaking so we can all hear each other. Just be respectful. We're gonna also do introductions. So when you get in the room, it's probably too many people to verbally say them, but just type your name and role or organization in the chat box. The moderator will paste a URL link in the chat box when we get in our rooms, and that will open up a Google Doc that has all the questions. And everyone has editing privileges, so please type your notes in there, especially if you don't get a chance to verbally say it out loud. Moderator will try to take notes, but if other people can kind of share that burden, that would be great, so the moderator can focus on moderating. Next slide. So here's our list of volunteer moderators. Thank you to everyone. I think some people might get combined together, and if so, we'll, they can help with note taking. I'm not sure how many groups we're making right now. Next slide, so discussion questions. Each group has the same questions. Please answer these from the perspective of your organization, but also you can answer them as a community member if you have something to add that isn't from your work, but is relevant. So thinking about immediately, what are immediate challenges related to your topic, things you're doing to respond to the challenges, and ways to make these responses more equitable. Short and midterm, so kind of thinking about while shelter in place is in effect, but once we've all sort of gotten used to this. So what will be your work priorities after you learn how to navigate the new normal? Are the ways to make the responses more equitable for vulnerable populations? And then thinking about the future beyond shelter in place, hopefully starting May 4th, but we'll see. What are challenges you anticipate facing at that time? How, if at all, are you already planning for this? And again, how can we make these responses more equitable? And then the last two are, what ideas do you have to continue to engage community members in both COVID-19 and non-COVID public actions and decisions, and what help, like information, resources, services, do you need to address these challenges? And with that, the answers from that fifth question, and actually all of these, the Planners for Health kind of group of us at Cal APA will be kind of taking this information and trying to figure out future resources or webinars to respond to the ideas and questions you generate during these breakout groups. So with that said, I think I'll let Diana and Ben send you to another virtual dimension and we'll all get to talk. Okay, we're back. Everyone's back in the room?
Yes.
Okay, so Diana, how many breakout groups did we have?
14.
You're muted. 14. Thanks, Ben. Okay, so if we want to do kind of one thing you heard from each facilitator, we can do that. I was Economic Development Room 1, so I'll go first. One thing I heard is there's kind of a uneven response from city leadership in terms of how employees can keep working and what they can keep working on from home. So some folks are struggling with trying to convince their supervisors to let them work on those back burner projects. Who is room 2?
I'm room 2. Hi, Beth. This is Heather.
Hi, Heather.
I would say that I heard a couple of things that would be worth sharing with the group. One is just kind of thinking about civic engagement and community engagement in a new era, and really thinking about inequities and access to broadband and the internet as we move more of our civic conversation and input and feedback functions online. And one of our participants talked about thinking about creating sort of, you know, at a time when we're able to perhaps gather again in small groups, having sort of digital stations around the city that people could use to access City Hall, and providing that at least throughout the period of time that we don't consider broadband access to be a basic public utility and a human right. And then the other one that I would just say is a city has been looking at housing their homeless population in hotels. I think that was the city of Encinitas. So I just also want to say as a facilitator that I had a fairly quiet group, and that everyone I think is just kind of figuring out how to communicate effectively and comfortably in these spaces.
Yeah. Thanks. We had issues with people being able to unmute in my group.
Same,
so hopefully
same
we'll
problem.
that out
Okay, thanks.
Oh, okay. Sorry, everyone. Keep typing into your Google Docs and we'll compile all those notes. Room 3.
Yeah. Hi, I'm Sagar, and I was in Economic Development Group 3, and we had the same problem. People were not able to like talk sometimes. So there are a lot of notes which I have not read, but one thing that was discussed was the unknown. So we know that we are in unique circumstances. We don't know how to respond. People are looking for answers and solutions, but not much is out there. So that was one thing that was discussed, like we would like to learn more, and there is a lot of unknown that
moderating.
we did talk about like general economic development impacts, like closure of businesses, closure of loss of jobs, also development projects may get stopped, considering we don't know how the economy will be impacted on the other side of this pandemic. So there is a lot of concerns there. And there was one that we agreed that we need, like, they had a suggestion for California APA chapter to provide sort of like a way so that people, as they learn, they can share information. In one place can be a Google Doc, can be other places that they can share. Like there can be a knowledge sharing exercise or knowledge sharing through some means, basically.
Thank you. Sorry, I had a little dog invasion. So group 4, and keep maybe 1 or 2 things just because we have 14 groups and
Hi, this
10
is
minutes
Natalie.
left.
I think I'm group 4. It was the moderator of the group.
Go for it.
We had some good discussions. I want to say just around how this relates to climate change, how this relates to slowing down development. Those are some challenges. How this relates to like everything in the name of public health and not really doing environmental considerations at the moment. And then I would say just helping local businesses, small businesses, restaurants, and helping local governments like prepare for the next big event, whether that's an earthquake or another pandemic, even wildfire. So that's all.
Thank you. Group 5.
I think
Perhaps it's me.
5.
Oh no, go ahead.
Okay.
Go ahead.
Is
Regina, were you gonna go?
so this is Julia.
Julia.
I don't know what group number I'm in, sorry. But it was housing, and what was most striking is that housing is obviously considered an essential service, and it's moving, as all development, at least the folks in my group, all development is, and so it's moving forward. So the folks in my group are just trying to figure out how to switch things online, how to allow for people to submit things digitally, and if that's not possible, what procedures should they use to keep staff and the public safe? And then how do we conduct public hearings? How do we do outreach in this new environment?
Sure.
Great.
Rodolfo,
Thank
would you like to
you.
speak now?
Okay, I unmuted myself. Hi, Rodolfo. We talked about a few things, but the 2 points that stuck to me is this is rapidly evolving. It's just rapidly evolving, and so we spend a week adjusting, and then we have to adjust the following week and the following week. The other thing that I think was a good takeaway, and again, y'all can refer to the notes, was the value of this particular space. Planners speaking to planners about planning and COVID versus looking at it in the news or hearing it through other sources. It seemed like a really important thing to highlight.
Great, thank you. I don't think it matters what number we're on, so any other facilitator who wants to share. I just want to make sure I get everyone.
The Transportation and Public Spaces group, we spoke about the new situation while everybody is at home ordered, that ridership is 80% down, and this is a new phenomenon and how to move forward with that. We talked about on both the public and private sector how the workflow is affected for all of us and how will our projects move forward, especially if there are cash flow issues, and what if the pipeline kind of gets stuck as we turn back towards normal. And a very important challenge was to make things equitable on all of our programs. We're seeing things come out in English language and not in multiple languages, even from organizations that typically do distribute information in multiple languages. So some of the ideas were for us to share listservs to try to get information out to a wide variety of people, and make it equitable is super challenging if everyone's not connected.
Thank you. Who else? Miguel, do you want to share your group?
Sure. I also had some technical difficulties, but we were able to have a little conversation. I think I was mostly the one speaking, but I had another, Amy was also able to contribute. So basically, through that conversation, we came to the conclusion that it would be really good to now start addressing public health in staff reports in a similar way as when you have to, you know, talk about fiscal impact. So now what could the health impact may be, or, you know, as a result of a proposed project, which I think I don't see that now as, I don't see people opposed to that idea given the lessons that we're learning. And the second one is similar to what Sagar shared, is that it would be great to have a Google group or a forum in which planners can ask questions, and planners who may have answer on, you know, a particular question, they can contribute and have an ongoing conversation. So I'll leave it at that.
Great. Who's next? Kate, I can jump in on the transportation breakout that we had. So I'll touch just on a few of the opportunities that came up, because I think we're all looking for that. We have a lot of challenges. So LA County is looking at this as an opportunity to catch up on some of the backlog in work across all departments. An interesting point, you know, really good time to do street projects because there are less users on the street. So I thought that was important to highlight. The idea came up of using this time to update plans and policies. So, you know, as we're potentially doing less of the implementation work, can we focus more on some of the things that we haven't been able to get to? And also with potentially less work on the public works side and some of the other departments, is there an opportunity to planning to work with those departments in a way that's more collaborative and might identify challenges at the early stage of the policy and the planning considerations? And then finally, I'm sure you guys have been thinking about this, but a lot of focus on utilizing this time to think about how to change remote work policies going back. Now that people are all equipped to do it, can we shift and provide more incentives? And then also, we talked about a lot of our communities, we're seeing an uptick in people biking and walking, and how can we keep that momentum up and shift towards more active transportation and telecommuting, or active transportation and cleaner, more sustainable commuting generally post-pandemic. Mm-hmm. Great, thank you so much. Natalie, have you gone yet?
Yes, I did go. That was the economic development group.
This is Diana.
I'm just going. Oh. Go for it, Diana.
Sure. So I had one of the other transportation groups, and it was also a little quiet, but a lot of similar things that the other group said. But a few things that I really liked is we had someone emphasize ability to share resources and information, not just with planners, but with other agencies or departments. And so they were giving an example like interacting with their marketing department or engineering, other departments that are also starting from scratch here. And so building that community and that knowledge. And then the second thing I thought was interesting is somebody else mentioned having a community meeting, I think it was yesterday in Riverside, where they had the option of a drive-through public comment. And so folks were able to drive through to where the meeting was happening and record their comment and then leave. And there were also options for calling in and putting comments online, but I had never heard of it, and I thought it sounded interesting. Great, and Josh, you can go now.
Okay, yeah, we had a good discussion. One thing that struck me was the differences around the state, that some places are mostly shutting down everything and other places are continuing more or less as normal, with maybe some of the staff staying home but others working. And then we talked a lot about the platforms for participation and in various settings like city council or planning commission meetings or CEQA scoping documents, and what's working, and particularly the challenge of how to make that equitable for people who don't have good internet access.
Okay, who else hasn't reported back? Cindy, did you report back?
No.
Or Jane?
Yeah, so this is Cindy. Was part of
Hi,
the
Cindy.
one of the housing and development groups. I think we're all, well, for me at least, learning to get used to this virtual meeting. I'm a very facial, in person. You get a lot with being in a room with people, so I think there was a little bit of that getting used to. But beyond that, I think our group had quite the range of backgrounds. We had someone in affordable housing, someone who worked for UCSF. We had some public sector planners, a contract planner. I myself was in the private sector, so I found it interesting to get perspectives from a broad range of backgrounds. The immediate responses to COVID seem a lot of like getting ready or protocols up to speed to address these things, such as equitable outreach, right? One of the room members mentioned Brown Act and how that works now that things are going virtual. How do you ensure that still is in place? And then talked about evictions and even rent extensions in those programs. How does that work with timing? It ties into a little bit of policy things, so really emphasizes later on the need for all of us to be talking to each other in any way this field is connected to each other. We talked about the homeless population. Bill, who's from San Diego, mentioned that in their city, they're converting convention centers to house the homeless population, which I think was a great thing to hear. I don't think we're doing that up here in the Bay Area just yet. And so hearing from other people about prioritizing, making protocols to get them ready and good to go so that we can all, or at least the organizations can use it moving forward. Seemed like a good plan. And then from LA, someone who's doing a lot of policy work, how their emphasis is on mindful work, so that after this kind of normalizes, things remain thoughtful moving forward. So I don't know if we had very many answers, but I think it was still a great discussion to have with many different backgrounds.
Thanks. So we need to wrap it up since we're at time. Diana, did you want to wrap it up, or am I supposed to be doing this?
Okay.
I can take it over. So thank you so much for coming. And thank you for going through all of our technical difficulties. We do want to emphasize that today, April 1st, is Census Day. The census this year, folks are able to take it online. So if you haven't, please go ahead and take the census. We will be sending summarized notes of this discussion, and as well as resources that our presenters Josh and Beth mentioned, and even Miguel. And we also just want to start this off as a call to action. We're, based on your feedback, we're going to be figuring out what our next discussion is going to be. You can also sign up to volunteer to help with these webinars as an organizer, curator, a speaker. We also have a steering committee for Planners for Health. So you can sign up if you're interested, and also just a general call to partner up with other organizations that are planning related, and even those that are not planning related, because we're all learning how to do this one day at a time. And Miguel, did you want to add any last words?
I just want to thank everyone who attended, and again, I want to reiterate my gratitude to Diana and the Northern section for making this happen. I think this is a great beginning for what sort of planners will be doing in the near and long-term future. So with that, thank you. Stay safe, healthy, and strong.
And Diana, go to the next slide. And if people have kind of follow-up ideas, you can email us. We'll kind of continue to think about what resources to bring together for next time.
Yes,
thank you, everyone.
Thank you so much.
can I add, this is Julia, can I add really
Oh,
quickly
yes.
too? That
Oh,
I,
yes.
I
Yes.
really appreciate the comments about APA California continuing to provide this space. I put our LinkedIn website on the chat, so please join. We'll be sharing more resources there, and we'll definitely be discussing with our with Northern California and the other sections how we can keep these kinds of conversations going. So thank you to the organizers, and thank you all so much for joining.
Thank you. Bye.
Thank you. Bye-bye.